Thank you for that very nice introduction. This session is sponsored by PetSmart Charities, and I can't say enough about PetSmart Charities as a supporter of animal welfare and animal shelters, and more recently getting very involved in promoting the education of veterinary students in these issues, particularly with supporting training for pediatric spay-neuters. So I know there are several representatives from veterinary schools around the country that are either already well underway with their shelter medicine programs or just starting new initiatives. And if you are interested in tapping into some of the very generous support that PetSmart Charities has set aside for veterinary schools, please do stop by and see them. They've also, I'm very proud to say that PetSmart was my very first funder for our non-surgical contraception research many years ago. They really led the field in recognizing that supporting animal research in this context was something that was very appropriate for their humane mission. And just imagine how much more effective we could be with our spay-neuter programs if we could just send technicians out into the field to inject cats in the trap and let them go rather than building big surgical infrastructures and hauling those cats in. I do some international work, and the opportunities for neutering cats in many developing countries are non-existent. They really do need a non-surgical alternative. I'm grateful for PetSmart for having that vision years ago and getting this started. All right, well, with that in mind, what I'm going to do for the next 20 minutes or so is talk about training opportunities for specialists in shelter medicine. All veterinarians graduate with general education in animal health and surgery, but that isn't what a lot of shelters need. A lot of shelters really need that specialty training in shelter medicine and high volume, high quality spay-neuter training that isn't part of the traditional curriculum for veterinary schools. This is a neglected area of training, and that is being recognized more and more, and there are more shelter medicine programs developing around the country, and that's very exciting. I have to say, though, that if you're looking for a veterinarian, look to UF first, because our student veterinarians that are interested in this field are getting amazing experience, and I'll talk about that a little bit. But particularly, we have some new grads who are exquisite spay-neuter veterinarians. Some have done hundreds of surgeries before they graduate, and of those veterinarians in the world remember that in most of our traditional training we might have had like 1 to 3 surgeries before we graduated. And there's so much opportunity now for students who are interested to get a lot of experience either with us or out with the externship programs that you all are running. And so we have some ready-to-go veterinarians for you. So why do we need to have specialists in shelter medicine? Why isn't a traditional training opportunity really providing veterinarians with everything they need to help shelters succeed? We have a job to do educating our profession about the scope and magnitude of the issue with shelters. To date, we don't have an exact number, but somewhere between 8 to 10 million dogs and cats enter shelters each year, and in many parts of the country, like here in the Southeast, a majority of those animals may be euthanized, not because it's a mercy killing because they're untreatable or vicious, but simply because we have not developed the capacity to place these animals in the outcome or home or back to the field that they really should go to. And sometimes that's because our communities aren't ready. Sometimes, though, it's because we are not efficient and targeted in how we utilize the resources that we have. And I think Dr. Moyer gave us a great start on the idea of developing SOPs and emphasizing why it's so important to do that, because when we have good processes, we can be more efficient and save more lives. But even in shelters that are really very streamlined and organized, have well-trained staff, there's very few that actually are funded at the level they would like to be to get all their work done, so they have to make hard choices all the time, and they need evidence to guide those hard choices. What truly are the best vaccine protocols, the best disinfectants, the best ways to adopt animals to assure that we're maximizing that capacity. And so this is where we need research and training by veterinarians to help us help shelters. And currently there is an extreme shortage of veterinarians that really do have the specialty level training. In population health particularly, most veterinary training is still focused on the individual animal, not on a population and these other shelter issues. If you go to the ASV website and you look at all the position announcements, there's usually at least 40 open positions for veterinarians in shelters or in spay-neuter clinics. And these agencies, even when they have really nice employment packages, are struggling to fill these positions. If that's you, we do have a board out front that you can announce your positions that you're recruiting for. Even if they're just volunteer positions, go ahead and put a notice up on the board in the hallway, and maybe you can network and get some of those positions filled with information here. So I'm going to talk about the topics that are included in specialty training and how we approach different levels of training, whether it be for veterinary students, so veterinarians in training, or whether it's for veterinarians who've already graduated but want to come back to be either a specialist or just want more information about how they can work effectively with shelters and rescue groups if they're in private practice. So we have a gamut from intermittent training like this conference to full-time training for residents that takes 3 years and several different programs kind of in between. And I'm going to use University of Florida as an example because it is the program I'm most familiar with, but many other universities also have pretty intense shelter medicine programs as well. So we use a combination of classroom teaching, in-shelter experience, and that's where we're going to be recruiting some of you to expand our classroom laboratories out into the field with your help. Clinical training, where we're actually taking care of patients at the vet school. Shelter consultations, where experts will go out into the field and do formal consultations for shelters. And emergency responses, whether that's big cruelty cases or natural disasters. These are some of our veterinary students that are on a rotation at our local municipal animal shelter here, looking at some neonatal kittens and helping develop a plan for their happy outcome. So one thing, of course, that we will focus on intensively is medical treatment of animals. This is something that, of course, the veterinarians need to take the lead on. In a lot of shelters, the medical treatment is actually developed by non-medical staff. And now that there are more animal shelters that are hiring veterinarians, we're working on transitioning some of that medical decision-making over to the veterinary team because that's where the expertise really lies. And that does mean that the veterinarian needs to be allowed to do more than spay-neuter. We know spay-neuter is critical. We also recognize that the veterinarian may be the most expensive person on the staff and that they're the only one that can do surgery, so they need to do surgery. But we also need to develop ways to make them more efficient in surgery so they have time left to do that very important protocol writing and to put eyes on animals in the shelter every single day. So a lot of our training, especially with our veterinary students and our residents, is focused on developing medical skills for the common diseases that we might see in shelters. And this is from a case that was taken care of by our students at our local shelter that are part of the clinical clerkship that Dr. DeGangi and Dr. Azasa run. So it's a puppy with mange. And you can see that with pretty straightforward treatment, this puppy has recovered from its infection, super cute, super friendly. It's been in foster care since it started treatment, and so is now a wonderful adoption candidate. We're going to have no problem moving this pup along quickly. And so this is something we can train veterinarians to identify, which is what are the easy-to-treat animals that we should really invest in. And then we have surgical treatment, and of course, we're all aware that spay-neuter surgical efficiency and skill is very important. We work very hard to cultivate that in our veterinary students, but we also focus on other ways that veterinarians can turn treatable animals in the shelter into healthy and adoptable animals. This is another case from our student rotation at our local shelter, and you see it's not uncommon to have neglected dogs come in with these embedded collar injuries. They can look quite awful. Here is the dog when it's just been anesthetized and clipped up a little bit. This is after just a few days of medical management, what it started to look like. These actually will heal very quickly once the collar is removed. and then finally after some surgical intervention to hasten healing. And this is another dog that with a relatively small amount of surgical intervention now has been cured of what was a horrible injury and is ready for adoption. And so our students will be very involved in the management of these cases, and the funding for some of this surgery and special care has been coming from private donors, as well as the Humane Society VMA, which has provided grants to the students to give them alternatives to surgical labs so that they can actually learn their surgery skills on animals that need it. But then one thing that a lot of people don't think about when they think about what veterinary services are in the shelter is beyond the individual patient care, we have population treatment or treatment of the entire population. Veterinarians who are trained in large animal and herd health are very familiar with these concepts, but they aren't trained for companion animal species generally. So part of our training for both our students and our specialists is how to evaluate the health of the shelter as a whole. And we like to put it sometimes in the context of the veterinary patient-client relationship. Veterinarians are very familiar with that triad, but if you haven't heard it before, there is a legal relationship that the Practice Act defines and regulates, which involves the veterinarian, the client, and the patient. And the expectations for all three of those participants in patient care are defined by the Veterinary Practice Act. When we go to shelters, we consider that the shelter is our patient, that shelter management is our client, and that our consult team is the veterinarian. So we do have a patient, but we don't bring a stethoscope necessarily to our examination. When we're looking at populations, we'll ask shelters to give us a lot of data that we're going to analyze for management of the population, similar to what Dr. DeGangi described this morning, of looking for choke points and places where animal flow through is not optimized or where live release is not being optimized. We'll do health surveys and surveillance to look at how we can keep animals in shelters healthier and provide these recommendations back to shelters. We'll help the shelter define its own capacity for humane care so they don't exceed that and end up in a vicious cycle of disease and unnecessary death. So this is what our output might be. Instead of having a surgical wound that's recovering, we may have data like this that shows the live release rate. This is Jacksonville Animal Care and Protective Services and the increase in live release that resulted from their Feral Freedom cat neutering program. What you see is for the previous 2 years before this program started, the live release rate for cats was about 10% in this massive municipal shelter that was taking in many, many thousands of cats a year. They started a program where they diverted feral and shy cats into a return to the field program, and almost overnight their live release rate shot up well over 50%, and in non-kitten season it can approach 80%. So that was overnight an amazing increase in live release and a program that we've been promoting as a model that should be used around the country. When we do our shelter consultations, we have formal training for how to perform these, and we involve our veterinary students as well as our interns and residents in these training programs. We can do very to the point and easy consults. You might call us, and many of you have, or sent an email with a problem that you're having, and it's pretty confined and easy for us just to deal without even going to your shelter. You might send us some data or some laboratory reports that we'll review, and we'll call you and make some recommendations. We also get calls from folks all over the southeast and really around the country for disease outbreaks. We have a huge problem with distemper in Florida, and we're almost always in the middle of helping organize some kind of distemper response in shelters. We have others like ringworm and panleukopenia that occur. Well, we may go to the shelter, but in a very focused way. So if there's a concern about upgrading surgical standards in the shelter, we might just go there and focus on the surgical routine. And here's Dr. Crawford looking at a very skinny dog in a shelter that did not have a veterinarian. So it was very hard for them to develop veterinary care protocols, but they need to have them nonetheless. So they asked us to come down and help them work on that. But what we also do are these comprehensive shelter assessments. And these are massive projects. We usually have a couple months of preparation where we're reviewing protocols that are in use, and looking at the population data. And then we go down to the shelter and spend about a week on site, spending a lot of time with staff and just observing processes and maybe having meetings with community stakeholders to find out what the perceptions from outside of the shelter are. And we'll produce a massive report, usually a couple hundred pages or more, with a lot of data showing shelters what their current situation is, as well as making recommendations for how they might do things differently to maximize their life-saving capacity. And then we do like to continue to work with the shelters after our visits to help them implement. And as we're doing these shelter consultations, we're helping our trainees, our students, and our specialist veterinarians work with shelters to identify what their real opportunities are for improving their operations. And this is just an example of some changes in cat housing that occurs from traditional 2x2 cat housing, which we know does not meet the needs of cats, contributes to a lot of stress and a lot of risk of upper respiratory infections, and then modifying it with housing that cats find much more suitable, that reduces their stress, keeps them comfortable, and that allows animals to stay healthy and get out of the shelter faster. As I mentioned, we do a lot of disease outbreak intervention, and sometimes these diseases occur in a shelter that is doing everything right, but you can't guarantee that a bad disease won't enter the shelter and then spread. Or there's other times when shelters have chronic disease problems because they may not have a program for vaccination on intake or identifying and promptly removing sick animals from the general population. So not only will we go down, help them diagnose the cause, screen the animals, and develop up a quarantine and a response system, but we'll also look at their protocols to help them avoid recurrences of this. This keeps us very busy here in the Southeast. This is Dr. Azasa and her team of veterinary students with going to one of our local rescue groups that had a parvo outbreak. This is some example of how we might look at disease data when we're doing an outbreak intervention to figure out what happened and when the outbreak is over so they can resume normal operations. Some of you may have heard about a situation in which 200 puppies were imported from Puerto Rico with the goal of sending them to New York for a big adoption event. And unfortunately, when they landed in Florida, which was supposed to be a short stopover, they were already breaking with parvo, and then a few days later, the distemper started going through this group of very susceptible animals. And nobody was prepared for quarantining 200 dogs on site. The state vet locked it down, and so our group went down along with the ASPCA to help manage this outbreak. And ultimately, about half of the dogs were euthanized for infection, but the other half of the dogs were saved and went on to adoption in Florida groups, which is something that in the past wouldn't have happened. In the past, this whole group would have been depopulated because there was neither the knowledge nor the resources to manage them for months until they had all recovered from infection. And a lot of you, I know, volunteered on that deployment and helped us with those dogs. We've also are kept busy in Florida and elsewhere on large-scale cruelty cases, whether it's dogfighting cases or cockfighting or hoarding responses. And again, we take our students and our trainees and integrate them into the response systems that we have. They're always multi-agency responses, so there's a lot of coordination and training that needs to go on in order to harmonize all the responders and make sure they're effectively working together. This is something that we're going to be increasing at UF because the ASPCA is embedding a unit of employees that work for the A, but they're going to be based at the vet school. And so we'll have even more training available in forensics and disaster response and be able to be more nimble in our responses here in the Southeast as that program builds out. For those of you who participated in the 10th Life hoarding case with 600 cats, this is some of our UF staff that responded and helped with that case. This is Dr. Melinda Merck working with some of our students, teaching them how to perform a cruelty examination in a way that's documented so that when this case goes to court, we can get a good prosecution. And so this is a case from our local animal shelter of an emaciated dog found on the end of a chain near death. She was brought over to the veterinary school because she needed a blood transfusion. I think she had a PCV of 11, which is really low for a dog and really low for a pit bull, since they're usually pretty robust, but she was cared for at the veterinary school by our students. So another student's involved in a dogfighting investigation and helping document the injuries to the dogs that were involved in that case. Also helping do behavior assessments to liberate some of the dogs from the case so they could be adopted. And as you know, there's a trend now to start evaluating dogfighting case animals individually for behavior, whereas in the past it used to be that it was viewed that no dogs from a dogfighting intervention were appropriate for adoption. We know that's not true now, so our students are learning how to evaluate dogs for suitability for adoption. We have a veterinary forensics component, and this is largely led by the ASPCA. So we'll have our forensics conference in March that I hope you can come to. It's going to be an outstanding lineup to cover things like, and it will focus on hoarding, but forensic evidence collection from the scene and from the animal, forensic necropsy techniques. Here's Dr. Crawford actually excavating a grave from a hoarding case that we were involved in. It was actually reptile hoarding. There's some of the dead and live reptiles that were recovered, but she also, because of her training, had recognized that there was probably a grave site on the site, and so it turned out that there was a dog buried in this grave. We have wet labs at times for training about forensic necropsy techniques as well. This is one in which it was a cadaver lab. So we acquired cadavers from a shelter after they were euthanized for other reasons, and then set up forensic scenes where the veterinarians that were working with this lab went through and tried to figure out which instruments had been used on these sort of faux cruelty cases. Disaster in Florida is a huge thing, and so we're constantly responding to disasters and training. We have our own disaster response unit at UF, and it's integrated into Florida SART and the FBMA disaster response system, and so we're constantly training and doing drills. This is some of the portable equipment we can take into the field for emergency veterinary disaster response. Training like this for how to rescue large animals. And we've actually been deployed a few times to get animals out of wells and off cliffs and things. This is our most recent hoarding intervention. This is the Haven Akers case right here in Gainesville. And we partnered with HSUS and a lot of other teams that were brought in to care for these 700 cats. This case started in June and just finished last week. So you can imagine how demanding that was to set up and run an emergency shelter for 700 cats, many of which were quite ill. And when we're lucky, we get to take our trainees on international trips. This is a trip we went to for India on a rabies control program into a very rural area. Family bringing in their pets, and we also turn these into research projects. And so in this case, we're identifying all of the animals that we vaccinated and microchipped. We also put a mark on them so that we could identify which ones had already been done, since many of the dogs were just community dogs. And then we also collected blood samples and fecal samples to bring back for infectious disease survey to find out what the impacts on dog welfare would be, as well as the impacts on human health in that village. A little rabies vaccine clinic with our resident Dr. McManus here on the side of the road. As you've seen from our posters, we do a lot of research. We're very frustrated when we're in the field because frequently we don't have the information that we need to answer the questions that shelters have of us for how we can do a better job. So we have an extensive array of research that we're doing either here at UF or also in the field with shelters, and we'll reach out to you at times with invitations to help be part of our research so that we can do a better job with care of our animals. So I'll just finish with how exactly our training programs work and how you might participate with those. We have two main focuses, one on the veterinary students who are not yet veterinarians. This is really where we can have the biggest impact because a lot of, as you may have heard, most veterinarians are women now. There's a whole kind of new trend in veterinary medicine of compassion and public service. And so if we can get new students, many of whom are actually coming to Florida because of the university, because of our shelter medicine program, if we can get them trained up right from the beginning, it's going to be very easy to find veterinarians who will work with shelters, whether these vets are in private practice or working for shelters themselves. Different than some veterinarians now who have still a pretty hostile attitude towards spay, neuter, and animal sheltering. But then we also need to have resources for training veterinarians who are already graduated. So we do have 4 programs. One is the Veterinary Student Certificate in Shelter Medicine. We have an internship. An internship is a 1-year program for a veterinarian who's already graduated in intensive training. And when we have the residency, which is a 3-year program, and that's what it really takes to become a specialist in veterinary medicine. And I'll talk about in a moment, too, that we know that not everybody can come to the University of Florida, so our next advance is going to be putting a lot of our training online so that students and veterinarians who are not at UF can receive it. Our certificate in shelter medicine, the students actually have to take 15 units of elective credit. It's a massive amount of extra work, and it covers everything that we do in shelter medicine, and including coursework that we have at the vet school in these topics, as well as going out and working in shelters. The externships are where you can help us. You've got a lot of information in your handout about what our externship program expectations are. We send students out to high-quality medical and spay-neuter programs in order to learn at the side of a mentor veterinarian how to be a good shelter vet. So what we're really looking for in these programs is a structured program where there's a mentor veterinarian who can spend time working with this student. We don't want to just send our students out to shelters where they're really not getting training in what a high-quality program can offer to a shelter. So please read through that, and if you're interested in learning more, please email me and we can talk about your program and how it might fit. We are actively recruiting for more shelters to accept our students. The internship is brand new, 1-year training in shelter medicine for graduate veterinarians. About half of the time will be in shelter care, working with another shelter veterinarian. About a quarter of the time will be specialty rotations in our teaching hospital, so surgery, medicine, dermatology, things like that. And about a quarter of the time will be didactic training with us. The program for applying for this is through what's called the Veterinary Intern Residency Matching Program. It's online. You can learn about our program online and apply that way. And these programs start in July. So July 2012 will be our first internship. These are our 4 residents that we've admitted so far to our program. Our residents really are the lifeblood of our shelter medicine program. They work really, really hard. You can ask them. I think they'll agree. They work really, really hard. And this is not a 40-hour-a-week job, but they are very busy in all aspects of shelter medicine, and if you call our program, they often will be the face of our program that will take your call or email. Again, this is through the VRMP application process, and we're taking applications now for July. And then finally, I'd like to introduce everybody to Dr. Terry Spencer. She's our newest faculty member that was hired along with Alicia Magruder to lead our development of our distance learning program. And so this is the program coming soon. We will put our online certificate in shelter medicine online so students everywhere can take it. And we'll also are developing specialty training modules for residents, interns, and veterinarians at other institutions. So be watching for this. We'll be actually rolling this out over the next couple years with some content coming relatively soon. So with that, I would like to thank Maddies Fund for making our program possible. They pay for all of our faculty and our student training and our residency program, and they subsidize our consultation service so that we can make it available to shelters when they need us, even if they can't pay for the full costs of it.